Voice loss happens often after thyroid surgery. Now, why does that happen? And very often people are so shocked when it happens to them, and all that shock comes into the therapist's room, because while they might have signed a form given to them by the surgery team that says this might be a possible outcome, of course, sometimes we don't take all that stuff in very well. So when it happens, there's often quite a lot of shock. When surgeons operate on the thyroid gland, and very often they have to because there might be cancer cells there, they might take away part of the thyroid to do a biopsy, or they might end up taking away all of the thyroid gland eventually on one side. And the laryngeal nerve goes very close to the thyroid gland and it's very tricky sometimes to be able to remove the thyroid gland without at least bruising or partially damaging the laryngeal nerve. And this can be just a little bit of damage, or it can be a cut, or it can actually be a much deeper cut. And that, of course, will stop off the supply to the vocal cord, and that will cause the vocal cord to not move very well, either partially not move very well or completely not move very well. And it can get fixed in one position here or in the middle, and the other vocal cord will just be trying to do its best to make contact. But very often, you'll be left with a breathy voice or a weak voice, very hoarse voice, and in some cases no voice for quite a while. The voice loss or the voice difficulty tends to take quite a varied path. For some people, they'll just have very poor voice following the surgery quite quickly. Other people have said to me that they had some voice and then over time it got slightly worse. And whenever there's a voice problem following a surgery, there's very often a little bit of a swallowing issue as well. Because vocal cords, they need to close over to protect your airway, and if they're not fully closing over, sometimes things can trickle down into the windpipe a little bit, particularly things like saliva, and when you're drinking fluids, it might not clear as well. Vocal cords need to close well to protect our airway, and if that's not happening, sometimes saliva or fluid will trickle down into the windpipe and cause a cough. So a cough or throat clearing is a common part of having voice loss after surgery. The question, of course, people want to know is, will my voice get better? In most cases, yes, it will get better. It does need some specialist help, and very often that's not just from a speech therapist, it's also from the ENT surgeon. So an ENT surgeon is somebody who will be able to look at the vocal cords and assess the closure, because the thyroid surgery is not done by an ENT, it's usually done by another type of surgeon. When the voice isn't working well, then at that point they'll get referred to ENT, and the ENT will be able to assess the level of the weakness. Very often, if there's a little bit of movement, they will refer to a speech therapist first. They'll do that in most cases, actually, and then we'll see what kind of benefit can occur with voice exercises to help the closure and help stimulate the movement of that vocal cord. The other vocal cord will start to work a bit harder to meet the other cord, and so we're also encouraging that post-surgery. In fact, sometimes that's all the recovery that you get, is that one cord will travel so much better, take over, do a bit of compensation and work really well to meet the other cord better. And then we assess how that feels, whether that's enough voice back, whether there's no residual swallowing problem left from that. But if the voice is just very effortful and the quality is not returning, very often the ENT surgeons will trial a vocal injection to plump up the cord that is not moving very well, so that it's easier for the other cord to travel over and to touch it and make closure, where you'll get a stronger voice with that. They'll trial an injection, and sometimes you can just repeat that injection every 6 months or so. And there's another more permanent procedure where they put a little tiny implant in, which just moves the cord over a little bit. It just goes pushes the cord over, and then it keeps that cord in place so the gap is a little bit smaller and the other cord doesn't have to work so hard to touch it. If you've had to have part of the thyroid gland removed or all of it, the thing to remember is very often that has to be done. It's often life-saving to remove that, especially if there were cancer cells or if there was another reason why it had to come out. It has to be done. But one of the possible side effects might be a little bit of damage to the voice. In most cases, this is temporary, and some voice will return just by its own accord. Sometimes people won't get voice symptoms after, but if it does happen, it could be a temporary thing that might recover quite well by itself given time, but very often needs a little bit of specialist help to recover. And particularly for people like singers, it can be quite devastating because they lose the power in their voice and they can't go as high. But that's another reason to see voice specialists, because that really will need some guidance to restore that. They may or may not need some of the surgical procedures we talked about. Very often with singers, they prefer to try and work without surgical procedures to see what they can recover themselves. Again, it's not the end of the world. Voices have recovered, singing voices have recovered post-thyroidectomies as well. But just to be aware that these things can happen and that it's well known to speech therapists and to ENTs. We work with it all the time, and that we're here to help with those issues. If you found the video helpful, press the like button and subscribe to the channel.